What if I told you that some of the most severe forms of brain damage might not be permanent after all? What if the brain isn't actually broken, but just stuck? Today, we are diving deep into a medical mystery that really challenges everything we thought we knew about neurological recovery. It all starts with these incredible, almost impossible stories of people suddenly waking up.
I mean, just imagine that. Imagine watching someone you love drift away into the fog of Alzheimer's, and then, in a single moment, they're back. That's a quote from Pat. Her husband was given a single injection, and the change was so fast, so complete, she said it was like having him back instantly. And believe me, this is not an isolated case.
Or let's talk about Linda, a teacher who had a massive stroke. Before this treatment, she could barely get a sentence out, she could hardly walk. Her doctors basically told her this is your life now. But then, just minutes after one injection, the fog just lifted. Her speech was suddenly crisp, her thoughts were clear. In her own words, it was like someone had just flicked the on switch inside her brain.
And it keeps going. Take Charlie, a machinist whose mind had been so scrambled by Alzheimer's, he couldn't even remember his own job. After treatment, not only did he remember working on the Hubble telescope, but his ability to just have a normal conversation came rushing back. So what in the world is going on here?
Okay, so here's how we're going to unpack all of this. We've just heard about these impossible awakenings. Next, we'll look at the two very unlikely drugs behind them. Then we'll get into the wild new saturated brain theory that tries to explain it all. After that, we'll see how these drugs might be flipping a switch, tackle the huge controversy around this, and finally ask what this could mean for the future of brain recovery. All right, so the drugs at the center of all this, they aren't some futuristic gene therapy. They're actually surprisingly common medications. One is for arthritis, and the other is a sleeping pill. And somehow, they're producing these totally unexpected, almost paradoxical results. So on one hand, you have etanercept. It's an anti-inflammatory drug, right? It's designed to treat things like rheumatoid arthritis. And on the other hand, you have zolpidem, which you probably know as Ambien. It's a sedative. It's literally designed to put you to sleep. So one is supposed to calm down your joints, the other is supposed to knock you out. Yet for these patients, they both seem to be doing the exact opposite. They're waking the brain up. So how is that even possible? Well, a really radical new theory is starting to take shape. And it looks at the brain less like a soup of chemicals and more like, well, like a piece of high-performance hardware that can get locked into a failure state. This idea is called the saturated brain theory. Now, to get your head around this, you kind of have to learn a new language. This theory basically translates biology into engineering terms. So an inflammatory protein like TNF-alpha, that's not just a molecule anymore. No, it's the master gain knob, turning the brain's volume up or down. Sensory overload, that's signal clipping, like when an amplifier is turned up too loud. And a brain that's stuck in a dysfunctional state, that's not permanent damage. It's a hysteresis latch, a system that's frozen in a fail-safe mode. And the core idea here, what's really fascinating, is this concept of signal saturation. The theory goes that after something like a stroke, or with a disease like Alzheimer's, the brain's internal volume knob gets cranked all the way to 11. You get this flood of excitatory signals, mostly from a chemical called glutamate. And it creates so much internal static that the real signals, for speaking or moving or thinking, they just get drowned out. They get clipped, just like distorted audio from a blown speaker. And the way the brain gets into this state, it seems to follow a specific pattern. First, you have what's called a standing wave. That's just some baseline chronic noise in the system. Then an impulse event hits, a shock, like an injury or an infection. Those two things combine to create a monster wave that just completely overwhelms the brain's defenses. And that's what leads to the final critical state, the hysteresis latch. The brain's security system flips on, and then it gets stuck there even after the danger has passed. Okay, so if the brain is latched in this high-noise defensive mode, how in the world does a sleeping pill or an arthritis drug manage to unlatch it? Well, this is where the engineering solution comes in, and it's pretty brilliant. Let's start with zolpidem or Ambien. It basically acts like a signal pad. It works on these things called GABA receptors to quiet the whole system down, turning down that global noise. And when the static goes down, the real signal, consciousness, can finally come through. Now, etanercept, the arthritis drug, works a bit differently. Think of it as a rapid heat sink for inflammation. It directly targets that master gain knob, TNF-alpha, and removes it from the system, instantly turning the volume way, way down. But
And this is a really big but. Despite these incredible patient stories and this really compelling theory, the mainstream medical community is, well, they're deeply and very vocally skeptical.
On one side, you've got these powerful, undeniable experiences from patients like Linda. For them, this isn't just a theory. This is the moment they got their life back. It's the moment their mom could speak again, or their husband could finally remember their name. It's real. But on the other side, you have leading neurologists like Dr. Jeffrey Saver from UCLA, and his take is blunt. He argues that without proper, large-scale clinical trials, these stories are just anecdotes. And offering this treatment, he says, is no better than being a snake oil salesman preying on the hopes of desperate families.
And look, the path to this becoming a mainstream treatment is blocked by some really serious hurdles. First and foremost, there's a huge lack of those gold standard clinical trials. The treatment is also incredibly expensive. We're talking up to $6,000 per shot. And it doesn't even work for everyone. About 1 in 5 patients don't respond. The American Academy of Neurology has even issued a warning against it.
So where does all this leave us? If we put the controversy on hold for just a second and we just look at the implications, well, they're staggering. I mean, what if this new model of the brain is even partly right?
This is a massive paradigm shift. It completely reframes how we think about brain recovery. It's no longer about trying to manage irreversible damage. It's about rebooting a system that's just stuck. The goal isn't to fix broken hardware anymore. It's to turn down the noise so the original software can run again.
So I'll leave you with this final thought to chew on. Have we been mistaking a system crash for a destroyed hard drive? And if that's true, could we be on the verge of discovering the Control-Alt-Delete for some of the most devastating conditions known to medicine?